Long-term complications of diabetes. Diabetes makes your glucose higher than typical. After numerous years, a lot of sugar in the blood can mess up your body. It can hurt your eyes, kidneys, nerves, skin, heart, and veins. You could have eye issues. You could experience difficulty seeing, especially around evening time. Light could trouble your eyes. You could get visually impaired. Your feet and skin can create injuries and diseases. In the event that it goes on excessively long, your toes, foot, or leg may be removed. Disease can likewise cause torment, tingling, or overflowing in your feet, legs, and different territories. Diabetes may make it harder to control your pulse and cholesterol. This can prompt cardiovascular failure, stroke, and different issues. It can get harder for blood to stream to the legs and feet. Nerves in the body can get harmed, causing torment, burning, shivering, and loss of feeling. Nerve harm can likewise make it harder for men to have an erection. You could have issues processing the food you eat. You could feel weakness or have trouble having a bowel movement. High glucose and different issues can prompt kidney harm. Your kidneys probably won't fill in too and may even quit working. Accordingly, you may require dialysis or a kidney transplant. Individuals with diabetes regularly have depression, and the two illnesses might be connected. A few ladies with diabetes may have sporadic periods and may have issues getting pregnant. Diabetes increases the risk for dementia. Diabetes increases the danger of bone maladies, including osteoporosis. Low glucose hypoglycemia from the treatment of diabetes can likewise build the danger of coronary illness. Assume responsibility for your diabetes. It is critical to keep your glucose, blood pressure, and cholesterol in a healthy range. You ought to gain proficiency with these fundamental strides for overseeing diabetes and remaining as healthy as could reasonably be expected. Steps may include a healthy eating routine. Exercise. Drugs. If you're watching this video for the first time, please like the video and subscribe to my YouTube channel. Also click the bell to get notified of more amazing updates. Thank you. You may need to check your glucose day by day or all the more regularly. Your healthcare provider will likewise help you by requesting blood tests and different tests. All these may assist you with fending difficulties of diabetes off. You should check your glucose level at home. You will utilize an exceptional gadget called a glucose meter to test your glucose. Your supplier will inform you as to whether you have to check it consistently and how frequently every day. Your provider will likewise mention to you what glucose numbers you are attempting to accomplish. This is called dealing with your glucose. These objectives will be set for various occasions during the day. To forestall coronary illness and stroke, you might be approached to take medication and change your eating regimen and movement. Your provider may request that you take a medication called an ACE inhibitor or an alternate medication called an ARB, for hypertension or kidney issues. Your provider may request that you take a medication called a statin to hold your cholesterol down. Your provider may request that you take anti-inflammatory medicine to forestall coronary episodes. Inquire as to whether headache medicine is directly for you. Standard exercise is useful for individuals with diabetes. Converse with your provider first about what activities are best for you and how much exercise you ought to do each day. Try not to smoke. Smoking exacerbates diabetes entanglements. In the event that you do smoke, work with your provider to figure out how to stop. To keep your feet sound, you should check and care for your feet consistently. Get a foot test by your health provider no less than 6 months to a year and realize whether you have nerve harm. Ensure you are wearing the correct sorts of socks and shoes. A medical caretaker or dietitian will instruct you about great food decisions to bring down your glucose and remain sound. Ensure you realize how to assemble a decent meal with protein and fiber. See your doctor often. In the event that you have diabetes, you should see your provider like clockwork. At these visits, your supplier may get some information about your glucose level. Continually bring your blood glucose meter to each visit. In the event that you are checking your glucose at home, check your blood pressure, check the inclination in your feet, check the skin and bones of your feet and legs, look at the back part of your eyes. The provider may likewise send you to the lab for blood and pee tests to Ensure your kidneys are functioning admirably. Consistently ensure your cholesterol and fatty oil levels are sound each year. Check your A1C level to perceive how well your glucose is controlled every 3 to 6 months. Visit the dental specialist at regular intervals. You should see your eye specialist once per year. Your provider may request that you see your eye specialist all the more regularly. For more amazing guide and tips, follow the link below for a diabetic-free life and meal plan. For any comment or contribution, or even as to what my next video should concentrate on, kindly leave a comment in the comments section. Thank you.